Warning: watch this video or you will regret it. In the elderly, there is a very common disease that is often overlooked. No fever, no severe pain, no sudden collapse. It just silently comes, destroying every organ in the body until it's too late. That disease is diabetes. Many elderly people live with high blood sugar for years without knowing it. They only discover the disease when their eyesight is blurred, their legs are weak, their kidneys are failing, or worse, after a stroke or heart attack. Diabetes in the elderly is dangerous because it doesn't cause obvious pain, but the consequences are much more serious than in younger people. And the sad thing is, most elderly people only know about the disease when complications have occurred. In this video, we will uncover the truth: why diabetes is a silent killer in old age, and what to do to prevent it. Diabetes in the elderly, the hidden culprit of a series of complications. Diabetes or diabetes is a condition in which blood sugar is always higher than normal. In the elderly, diabetes is mainly type 2 due to metabolic disorders and decreased insulin sensitivity over time. What makes diabetes dangerous in the elderly is that it progresses silently. No abdominal pain, no fever, no convulsions. Just more thirsty, urinating frequently, especially at night, eating a lot but still losing weight, vague fatigue, dizziness, slight numbness. These symptoms are easily confused with normal old age. Therefore, many people live with the disease for many years without being diagnosed. In fact, many people only discover they have diabetes when they go for an eye exam due to blurred vision or after a major event: myocardial infarction, stroke, kidney failure, foot ulcers, etc. Diabetes is not just a disease of blood sugar, but is the culprit of a series of dangerous diseases such as cardiovascular, kidney, eye, nerve, and infection. This is especially worrying in the elderly. When the immune system is weak, resistance is reduced. Therefore, although it does not cause pain, diabetes is still a silent killer and needs to be identified early. Why is diabetes especially dangerous in the elderly? There are three main reasons why diabetes becomes more dangerous in the elderly. 1. Weakened body. Complications come faster. The blood vessels in the elderly have sclerosis with age. When blood sugar is high, small vessels in the eyes, kidneys, and nerves are more susceptible to damage. Complications such as blindness, kidney failure, foot ulcers, etc. come quickly and are difficult to recover from. 2. Difficult to control and treat. The elderly often have many other diseases: high blood pressure, cardiovascular disease, hyperlipidemia, gout, etc. Taking many drugs can easily cause interactions. In addition, the diet and exercise of the elderly are also limited, making blood sugar control more complicated. 3. Subjective, resigned mentality. Some elderly people think, "I'm old, how much longer can I live? Why worry about taking care of myself?" That thinking makes them ignore treatment, not have regular checkups, eat and drink carelessly, and as a result, complications occur that cannot be reversed. In addition, hypoglycemia in the elderly, even just once, can cause falls, strokes, and coma, especially when living alone or without close monitoring. Diabetes in the elderly is not just a disease, it is also a long-term battle that requires knowledge, discipline, and perseverance from the patient and the whole family. Silent but devastating complications. If not well controlled, diabetes can lead to a series of dangerous complications, especially in the elderly. 1. Eyes, blindness. Diabetes damages the retina, causing blurred vision and reduced vision. If not treated early, it can lead to permanent blindness. 2. Kidneys, chronic kidney failure. Prolonged high blood sugar levels can damage the kidneys. Patients may need regular dialysis, which is extremely costly and painful. 3. Cardiovascular, stroke, heart attack. Diabetes increases the risk of heart attack and stroke many times over, especially when accompanied by high blood pressure and high cholesterol. 4. Diabetic foot. Peripheral nerve damage reduces sensation in the feet. Even a small scratch can lead to infection, gangrene, and even amputation. 5. Systemic infections, wounds that are difficult to heal, a weakened immune system. The patient is susceptible to pneumonia, urinary tract infections, or blood infections. All of these complications do not happen overnight, but gradually eat away at health. And when they appear, there is no chance of turning back. Therefore, early recognition and control is the only way to avoid falling into that painful spiral. Preventing and controlling diabetes in the elderly. In addition to eating a balanced diet and exercising properly, the elderly need to pay special attention to self-monitoring blood sugar at home. A personal blood glucose meter is not too expensive, but it can help patients control their health more closely. In particular, it is recommended to measure in the morning before eating and about 2 hours after eating to know how the body reacts to each type of food. Recording daily blood sugar levels is also very useful when the doctor needs to adjust medication or treatment regimen. Do not underestimate the numbers because they are a mirror reflecting the internal condition of the body. In addition, family plays an extremely important role. An elderly person living alone will easily neglect taking medication, eat uncontrolled, or forget to return for checkups. Reminders, companionship, and encouragement from children and grandchildren will be factors that help them live positively and comply with treatment better. In addition, psychology is also a factor that cannot be ignored. When the elderly discover that they have diabetes, they often feel anxious, have trouble sleeping, and are pessimistic. This is when the family needs to reassure them that diabetes is not a death sentence, but just a companion, and you can live well if you understand it. Finally, don't forget that health is a journey, not a destination. Elderly people who control their diabetes will not only live longer, but also live healthier, happier, and maintain independence in their daily activities. The most valuable thing in old age. Diabetes is painless, but it takes away your vision, your health, your legs, and your life. Don't wait until complications appear before you rush to treat them. If you live with your parents or grandparents, pay attention to their diet, medication schedule, and remind them to get regular checkups. If you are the one who is entering old age, remember, healthcare is a right, not a burden. Diabetes is completely controllable. Living well at 60, 70, 80 is not far away. Just start today. If you find this video useful, please like, share with your friends, and subscribe to the channel to support me in creating more content about health and old age. Thank you for watching until the end. See you in the next videos.